Of course, topping the news this morning is, unfortunately, the sad news about the former Secretary of State, Colin Powell, dying from complications from COVID. Now, he is 84 years old. There are some multiple reports coming out about his health issues, but obviously it's going to really raise, the red flag about breakthrough deaths.
No, it's a sad day, and I think this is a loss for all of us. I think this is something Democrat, Independent, Republican. Colin Powell was a special individual, and I think we're all going to feel that loss. But it does, I think, raise a lot of important questions about vaccines. And so one of the things that I was actually having a conversation earlier this morning about is the fact that vaccines are not 100% really at any level of efficacy. So people who are vaccinated, they still can get infection, they still can get infected, they still can end up in the hospital, they still can die. But it's a tremendous reduction, right? We don't stop wearing our seatbelts because we heard someone died in a car accident and they were wearing their seatbelts. But if you compare the numbers, over 700,000 Americans have died from COVID. Only, I'm going to use the word only, 7,000 vaccinated have died. That's a tremendous reduction. It's not zero. And in a situation like Colin Powell, this gentleman, he was 84. Which is not great. He was a man of color, and we know that this disease has hit different populations with a tremendous degree of inequity. And he actually had a blood cancer, so not an individual we would feel confident would get that protection post-vaccination. So an individual that you would be considering doing those prophylactic monoclonal antibodies to try to give that extra level of protection. But yeah, this is a tragedy, but I think it's a reminder when people say, oh my gosh, fully vaccinated people, why are we wearing masks? Why are we doing all these things? There are vulnerable individuals like Colin Powell who still are at risk even when we have widespread access to vaccines.
And the CDC is tracking breakthroughs and doing it by vaccine.
I think that's really important, right? We need the information, and the CDC actually now has a wonderful COVID tracking page where you can go and you can look and you can ask all those questions. What about the different infections and the different deaths relative to different vaccines, relative to different ages? And you can see this tremendous difference. Certainly, every day a few people do die who have been vaccinated against COVID, but thousands, over 1,000 people are dying a day unvaccinated. So yeah, with this data is being tracked, we're keeping an eye on it. Not only keeping an eye on this, we're also following after the fact, how do those vaccinated people do if they survive that infection?